Hi, I hope you're having a great day and I hope you're staying safe at home. Well, yesterday we spoke about part one, an underactive thyroid gland and what you should be doing to nourish your underactive thyroid gland. And hopefully once you make those changes that we spoke about yesterday, you can work with your doctors to reduce your medication and over time even get off medication. Today we're going to talk about a Hashimoto's thyroid. Okay, to many people, this is a new term. You see what happens in the medical world. Again, I have nothing against the medical world, but you need to understand one thing today. There are millions of people with thyroid who don't even know what kind of thyroid they have. They're assuming they have an underactive thyroid gland, but a lot of them actually have a Hashimoto's thyroid gland. But the test is usually never prescribed. And there's a reason why you have to prescribe that test, because you want to know which kind of thyroid condition you have. Your next question would be, but then why doesn't my doctor give me these tests for a Hashimoto's thyroid, which we're going to talk about? Again, because even if your levels come positive, there's an ATG level, which is your anti-thyroid globulin, and you have your TPO, which is your thyroid peroxidase test. Even if this comes positive and you know it's a Hashimoto's thyroid, the medical world doesn't have any medicine to give you. So most doctors believe that anyway they're going to treat you for a thyroid gland. The medication is the same, whether you have an underactive thyroid gland or whether you have a Hashimoto's thyroid gland. So they don't believe in these tests. We've had the most challenges across the US, Europe, and the Middle East when we try to get patients to test for the ATG and the TPO. Their doctors tell them this is a useless test, don't do it, it's not going to help you. The question you need to ask yourself when your doctor tells you that is then why does it exist? Why is it a medical test? If it was a useless test, it wouldn't exist. But it is a lab test where you can get your ATG and your TPO tested. Now here's the reason why you should get it tested. Because in case it comes positive, in case your thyroid is diagnosed as a Hashimoto's thyroid, this gives you a clue that it is an autoimmune condition. Fine, there may not be a medicine for that, but there are several things that you can do to reverse a Hashimoto's thyroid. But you definitely want to know if you have an autoimmune condition, because today it could be an autoimmune condition called Hashimoto's. Tomorrow it could be an autoimmune condition called arthritis, multiple sclerosis, vitiligo, alopecia, psoriasis, eczema. So you see, when you're only looking at the symptom, you don't look beyond that. But when you're trying to address the root cause, it can go a long way in you preventing yourself from getting other autoimmune conditions, because you now know that you have an autoimmune condition and you're doing the right things to try to overcome it. Okay? So exactly what is Hashimoto's thyroid? Our immune system makes antibodies. Antibodies are kind of proteins which our immune system makes, which will fight bacteria, viruses, germs, and pathogens. But sometimes something irritates our immune system. There is something that annoys our immune system and makes it behave erratically. And these antibodies start attacking our thyroid gland. It starts attacking our thyroid gland, okay, and we develop these ATG antibodies, which an ATG test will tell you, and then you also get a TPO count, which is your thyroid peroxidase. When that level is high, your doctor can establish with you that your thyroid gland is under attack by your immune system. And that's why now you're producing lesser of your thyroid hormones. Okay, but at least you know it's an autoimmune condition. There's a lot that you can do, which I'll come to. Sometimes you do a test and you do your TSH receptor test. And now that tells you that your thyroid gland is being attacked by your immune system and producing excess thyroid hormones. So Graves' disease is an example of that. Some people go through years of thyroid medication and then finally their symptoms get worse and worse, and it's late. They already discover very late that they had a Graves' condition. We're going to talk about the symptoms for that. So if you have a thyroid problem, add the ATG and the TPO test to your list, so at least you know what you're being treated for. The medical world will give you the same medication irrespective. Take it. It's good for you. But there are so many lifestyle changes that you can make that can make your condition better. You want to know today why your immune system is behaving erratically to prevent it from getting worse and causing more serious conditions as we go through. So let's say you did your ATG and your TPO and it came positive. Okay, and your doctor tells you have a Hashimoto's, okay, based on that. What are some of the symptoms of a Hashimoto's disease? One is weight gain, no matter what you do, fatigue, constant fatigue, hair loss, low tolerance for cold temperatures. You know, you feel really cold, and even in normal temperature, you got to put blankets and jackets and coats. Irregular period cycles, they're completely irregular all the time. Your doctor's putting you on oral contraceptives, hormone replacement therapies, all of that stuff, but you're not getting better. You want to check if you have a Hashimoto's condition. Extreme constipation, even depression, because your thyroid gland controls your moods. So sometimes when you have depression, you want to get your thyroid glands checked as well, because a lot of people who are depressed have a Hashimoto's or an underactive thyroid condition. And joint pain, extreme joint pain, because that same immune system that is attacking your thyroid gland can also be in the early stages of attacking your joints. So it is so important to get this test done. When you do your ATG and your TPO, your doctor can also tell you through your TSH receptor test whether you have something called a Graves' disease. Now, what are some of the symptoms of a Graves' disease? It'll be the opposite. You will have extreme weight loss and you don't even know why. Bulging eyes. Your eyes tend to bulge out. They become bigger and bigger. You have tremors in the hand, unexplained tremors, which can also be caused by a low vitamin B12 deficiency, but if it persists, you want to get your thyroid checked for Graves'. Low tolerance for heat. Then you have trouble sleeping. You try to sleep, you're tired, your body's tired, but you just cannot sleep. You're not stressed out, there are no thoughts in your head, but you have a problem falling asleep. Increased anxiety, palpitations in the heart, increased heart rate. All of these small problems which would never trouble you before are now magnified, and they bring on extreme anxiety and a swollen thyroid. Always look back and see if this area is swollen, something known as goiter. So you see, these tests are so important. Why would you not do them? Why would you not do them? About 2 years ago, I had a patient in the US, and we told the patient, please go and get this test done. We even wrote out a prescription to their doctors, and their doctors laughed at them and said, please don't do all of this stuff and whatever. But yet they decided not to go with their doctor. They went private, paid for the test, got it done because insurance wasn't covering. And guess what? The patient had a Graves' disease, which means now the patient can be treated for it. So the medical world tells you it's useless. The first thing that you need to say then, why does it exist as a medical test? Now, what can you do if you have a Hashimoto's? This is where the beauty is. A lot. Over and above your medication, there is a lot that you can do. Number one, look at your gut health. Okay? If you have problems with your gut, something called a leaky gut syndrome, think of your gut as a thin fishing net with small holes. This is the perfect gut. Okay, we have something called villi, little fingers that stick out from this fishing net. Our food gets digested in our stomach, comes down to our intestine, and these little fingers pull all of the vitamins, the minerals, the nutrients, squeezes it through this thin fishing net into your blood, and your blood carries it to all of your organs and trillions of cells in the human body. This is a perfect gut. Now, because you've been eating too much of sugar, you're too stressed, you have poor gut health, you're constantly constipated, or you have IBS, or you have Candida, or you have gut issues where your bad bacteria grows more than your good bacteria. Now this bad bacteria is growing longer and longer and poking holes in that thin fishing net. So those small holes which were perfect now become larger and larger. And certain molecules and certain food particles which are supposed to exit your system squeeze through that thin fishing net and get into your blood, a place that it's not supposed to be. So what happens? This is a foreign invader in your blood. It's not supposed to be in your blood. Your immune system wakes up to attack it. It's the perfect defense mechanism. Your immune system is doing nothing wrong. It is rising to the occasion to protect you and attack it. So certain molecules that have entered your blood, it's called molecular mimicry. Some of these molecules mimic your thyroid gland, so your immune system attacks your thyroid gland. Some of these molecules mimic your joints, so it attacks your joints. You have arthritis. Some of these mimic your myelin sheath. They attack your myelin sheath and you have multiple sclerosis. Some of them mimic your skin. You have vitiligo, psoriasis, eczema. So do you see what happens when you have a leaky gut condition? A high TPO and a high ATG cannot reflect that you have inflammation in your gut. So you can start treating your gut. And when you start treating your gut and you relax it and your wall, that thin fishing net heals itself. It goes back to normal functioning. Your TPO count drops. Your ATG count drops, which means your immune system is not attacking your thyroid gland as much as it was before. There is so much that you can do to bring down your ATG and bring down your TPO. Example, someone who's gluten intolerant. The moment you cut out gluten, the TPO comes down. For someone else who is dairy, lactose intolerant, you cut out lactose, inflammation reduces, the TPO comes down, the immune system stops attacking your thyroid gland, and your doctor can reduce your medication and even get you off medication completely. If you're stressed out, the easiest way to upset your immune system is chronic stress. So when you're constantly stressed, your immune system is constantly erratically behaving. It's not normal. The immune system is used to a stress response of rising to the occasion, fighting, and then relaxing again. But when we constantly kept it stimulated, autoimmune, your immune system is working in overdrive. Even stress can be a trigger. Anxiety can be a trigger. Negative emotions that you constantly think of can be a trigger. Changes in weather can be a trigger. An allergy, a dust allergy, allergens can be triggers for an autoimmune condition. But by getting the TPO and the ATG test, you at least get to know what is happening in your body. You're not a slave to the medication, just taking that medication and 10 years later you realize you had a Hashimoto's thyroid and there was so much that you could have done that you didn't do. So you see, again, when it comes to healing your Hashimoto's, it's the same as yesterday. You are deficient in minerals. You need your MCT oil, you need your selenium, you need your zinc, you need your B vitamins. You need to learn to manage your stress levels. You need to sleep. Sleep deprivation can throw your immune system out of whack completely. You need to exercise, not intensely. Most Hashimoto's patients are diagnosed with something called adrenal fatigue. What is adrenal fatigue? It means that your kidneys are so tired of chugging out stress hormones all the time that it's called adrenal fatigue. You no longer can produce adrenaline in the right quantity. And that's a big, big problem for every aspect of your organ health, your brain health, and your body. So literally your body is so tired of being stressed that it cannot even produce the right amount of cortisol and adrenaline. So a lot of people with thyroid conditions, Hashimoto's, are underactive. They have gone through a lot of stress in their life. And one of the solutions to getting better is to learn how to manage your stress the right way. So these are the things that you can do. So I have not told you not to see a doctor. I have not told you to stop your medication. I'm telling you beyond that. You don't have to be a slave to your medication. Take your medication. When someone comes to us with high thyroid levels and they say, Luke, we don't want to take medication, sometimes we have to literally insist that they take their medicine as a crutch. So at least it's working while you change your lifestyle. And as you change your lifestyle and your immune system relaxes and it stops attacking your thyroid gland, guess what? Your reports are going to look better and your doctor is going to tell you, hey, reduce your medication and eventually stop it. So can a Hashimoto's thyroid be reversed? Absolutely yes. Absolutely yes. It becomes more difficult when you come with complications of diabetes and kidney problems and high blood pressure, basically something called metabolic syndrome. Then it takes more time. But is it impossible? Absolutely not. Because right now you know the root cause of your problem. Address your root cause and there is always a positive consequence. It may take you time. It may take you time, but there is a lot that you can do. So this is how you can heal your thyroid gland. Never ever believe people who say that you cannot. Now some people have a lot of their thyroid gland removed surgically because of cancers or other conditions and stuff like that. You may have to be on your thyroid medication for a lifetime because you don't have the gland to make the TSH. Or your gland is incapable of making the right amount of TSH. But you need to understand if something in your body isn't working the right way, a pill is not always going to help you. It's going to suppress the symptom. But you want to get your body glands working the right way so it can sustain you quality life for the rest of your life. And these are the things that you can do. Look at your gut, look at your liver, look at your stress levels, look at your diet, your exercise, your sleep, your lifestyle. In short, it is your lifestyle. Can it be done? As I'm speaking to you, there are hundreds and thousands of people who no longer have a Hashimoto's condition. So you want to know if you have an autoimmune condition. Today it's Hashimoto's, tomorrow it's going to be more dangerous. So you want to, either ways, learn to relax your immune system so it does not attack your thyroid gland anymore. Have a great day, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.